Hello, I'm Dr. Sandhya Panch. With over 16 years of experience treating patients with blood disorders, I have truly learned to treat the patient, not just the disease. And today, I want to talk about Doptelet, a prescription pill for adults with low blood platelets in chronic immune thrombocytopenia, or ITP, when other treatments haven't worked well enough. Wondering how Doptelet can fit with various treatment preferences? Just think LIFT, lift. L is for lasting. In a 6-month clinical trial, people taking Doptelet were compared to people not taking Doptelet. Doptelet gave a platelet count lift to 50,000 platelets per microliter or more in just 8 days. That's fast, and it also lasts. Platelet count stayed lifted to at least 50,000 for an average of 12 total weeks. I is for individualized schedule. That's right. Doptelet fits any schedule, literally any time of day or night, as long as it's the same time for each dose. And because it's a pill, it can be taken anywhere. Anywhere. F is for food freedom. Doptelet works with any food. Yes, any food. Ice cream, cream cheese, fruit and veggie platter, any food. Say goodbye to waking up at 5 a.m. to enjoy yogurt and cereal at breakfast time. T is for time saving. With Doptelet, there are fewer doctor visits, and there's no need to receive treatment injections or infusions, and there's no need for extra eye exams or labs to monitor liver functions. Remember, the Doptelet LIFT, lift, helps raise platelet counts without having to change some of your personal preferences. It is important to know that serious side effects, including blood clots, may occur. Tell your doctor about any swelling, pain, or leg tenderness, fast heartbeat, shortness of breath, chest or stomach pain or tenderness. Common side effects include headache, joint pain, fatigue, bleeding gums, bruising, petechiae, nosebleed, upper respiratory infection, and runny nose. Tell your doctor if you're breastfeeding, pregnant, or planning to be.
What are Doptelet, avatrombopag, and Doptelet sprinkle, avatrombopag? Doptelet is a prescription medicine used to treat low blood platelet counts in adults with chronic immune thrombocytopenia, ITP, when other treatments have not worked well enough. Children 1 year and older with persistent or chronic ITP when other treatments have not worked well enough. Doptelet tablets and Doptelet sprinkle are different dosage forms of Doptelet. Doptelet and Doptelet sprinkle are not used to make platelet counts normal. It is not known if Doptelet or Doptelet sprinkle are safe and effective in children younger than 1 year of age. Important safety information. Before you take Doptelet or Doptelet sprinkle, tell your doctor about all your medical conditions, including if you have ever had a blood clot, are pregnant or plan to become pregnant. Doptelet or Doptelet sprinkle may harm your unborn baby. Tell your healthcare provider if you become pregnant or think you may be pregnant during treatment with Doptelet or Doptelet sprinkle. Are breastfeeding or plan to breastfeed. It is not known if Doptelet or Doptelet sprinkle passes into your breast milk. Do not breastfeed during your treatment with Doptelet or Doptelet sprinkle and for at least 2 weeks after the last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Doptelet or Doptelet sprinkle may affect the way other medicines work, and other medicines may affect the way Doptelet or Doptelet sprinkle works. What are the side effects of Doptelet or Doptelet sprinkle? Doptelet or Doptelet sprinkle may cause serious side effects, including blood clots. People with persistent or chronic ITP and people with certain blood clotting conditions may have an increased risk of developing blood clots. Tell your healthcare provider right away if you get signs and symptoms of a blood clot, including swelling, pain or tenderness in your legs, shortness of breath, chest pain, fast heartbeat, stomach, abdominal pain or tenderness. The most common side effects of Doptelet in adults with chronic ITP are headache, tiredness, bruising, nosebleed, upper respiratory infection, joint pain, bleeding gums, purple or red spots on your skin, and runny nose. The most common side effects of Doptelet or Doptelet sprinkle in children with persistent or chronic ITP are viral infection, runny nose, cough, fever, and pain in the mouth or throat. These are not all the possible side effects of Doptelet or Doptelet sprinkle. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see the Doptelet or Doptelet sprinkle full prescribing information.